This is my mother. We are in my baby can find the bread.
What was expected to be a source of joy for Faustina turned into a serious struggle. 4 months after Faustina welcomed her baby, he started to develop a condition called macrocephaly. Macrocephaly is a condition in which a baby's head grows bigger than other babies of the same age and sex. Faustina, who comes from Ananikrom in the Asante Achim North District of the Ashanti region, searched in vain for a solution.
But when I gave birth to this child, his head was not big. When he was about 4 months old, his head started becoming bigger and bigger. We started roaming for herbal medicinal help. We didn't get any help, so we took him to Agogo Hospital. They could not help, so they referred us to Comfort Teaching Hospital. We could not get any money to go there, so we were home.
Augustina, a nurse at the Ananikrom Health Center, explains how Faustina's ordeal was discovered.
This is how we met Faustina. We were immunizing children in the community. When we reached the house, we asked how many children were there. She said just her child. When she brought the child, his situation was very bad. So I told her, I don't know whether we might get help, but we should take a picture of the child, because I remember Hope Foundation came and did free medical care for the people of Ananikrom, so I will send it to them if we can get aid from them. She understood. Then we took the picture. The network reception at the village was bad, so I was able to send the picture when I get back to Agogo. After sending it, he responded and said he will talk to his team. He called me after 3 days and said he will be able to help.
I think 3 days time no free say na me ayadum obenya amoa.
I let her take the picture. She later called after some time and came back to my house with the people she spoke about. They told me that they will take us to Comfort Teaching Hospital. We went there eventually and stayed there for a while.
After going through serious pains, Faustina eventually received support from the OKB Hope Foundation. Justice Kwe is the director of the foundation.
It was one of our screenings in a community in Agogo called Ananikrom. So I think it was after the screening. So the nurses used to go into the community for this vaccination program and all that for the children. And so I think the nurse got to the community and saw the child, and then immediately she drew my attention to it that they have a child there. I think he was about 8 months, and then the mother was like, after 4 months, she started, noticing that the child's head was getting bigger and bigger, and she didn't know what to do. She has no help. So the nurse, spoke to me, and I was like, okay, we'll see what we can do about it. So we came back to the city, and then we quickly arranged things, and then we were able to reach out, and then we brought them from the village to Comfort to go through the process and everything to be able to help the child. And I think the surgery has been successfully done, and the child is recovering and is doing great now.
According to the Ghana Statistical Service, about 67% of the population in rural areas have to travel more than 5 kilometers to access healthcare services, compared to 20% in urban areas. To bridge this gap, the OKB Hope Foundation has supported thousands of people across several deprived communities in the country.
The main motivation behind this organization of what we do is to be able to break healthcare, to make healthcare easily accessible. We believe that everyone deserves good healthcare. So for people living in the underserved and rural communities, we believe that they also have the same opportunity to also have access to this quality healthcare. We started in 2017. So from 2017, what we used to do was to have this annual screening. So we organize people, and then we have annual screening twice in a year. So from 2019, 2020, we thought of an idea how we could make this easy for us and also for these people living in the underserved communities. So from the inception of the mobile van, we've been to over 40 communities, and then we've seen quite over thousands of people in all these communities that we've visited. So for the main challenge, I'd say it's one would be the poor road network. That's a big challenge because most of these rural communities, they have untarred roads, and when it rains, it's difficult to really access it, but we are able to move through it. there are times that our van gets stuck in the mud and all these challenges, but I think through it all, we are able to, go through it and then be able to grant them, this primary health care that we believe that they deserve. We believe that when we're able to have or get more vans, we'll be able to reach out to a lot of other rural communities in Ghana, and not only Ashanti region, because we believe that there are a lot of people who have are not able to access quality healthcare because of the poor roads, because of financial constraints and difficulties, because of a lot of other reasons. But we believe that once we have put this on ourselves to deliver this primary healthcare service to these underserved and rural communities, we believe that being able to procure more vans for these communities would go a long way to help them, and also not only the vans, but any other support that could, in terms of healthcare personnel, people in the community that want to join us, want to volunteer. People who are professionally, licensed, who would want to volunteer to help us push what we do in these communities would really go a long way to help save their lives.
Many other people, like Faustina, commend the foundation for their commitment towards healthcare delivery in their communities.
When I came, all my children were sick. You came and took care of them without collecting any money. I thank you for your support.
Reporting for Orange FM, I'm Fatal Bayaga, Anna Nekrum, Asante Achim North District.